Excessive drinking has earned Uganda the dubious reputation of top alcohol consumer in East Africa.
This is the part of the world that has the greatest proportion of the alcohol is informally produced, often by people in their backyards. And that's true, I think, throughout East Africa. It's not just Uganda, it's Kenya, it's other countries around also.
Researcher Robin Room believes East Africa governments have a special problem in their attempt to restrict alcohol consumption. He says, unlike other governments, East African leaders lack control over the market. The Ministry of Health now wants to reverse this perception. It seeks to develop an alcohol control policy.
Our law is completely outdated and it is not having the effective penalties.
Initially, the government listened to what the industry had to say. That too has now changed.
The alcohol industry is incapable of self-regulation because they are breaking their own codes.
Associating drinking with sports and with social success.
So we are not giving them another audience.
And she's right to worry because researchers are concerned about an aggressive form of marketing following a research project on monitoring alcohol marketing in Africa. The researchers are mainly concerned about the marketing which they say has somehow increased consumption of alcohol, especially amongst the young population, which is the highest in many countries. For example, in Uganda, 56% of the population is below 18 years.
The alcohol companies, particularly the global producers, the multinational companies, have been moving into African countries in order to develop their markets and sell more alcohol.
The aggressive marketing is believed to be a driving factor for young people to start drinking early.
Well before the legal drinking age. And more marketing contributes, I think, to alcohol abuse later in life.
The research was done in Uganda, Gambia, Nigeria, and Ghana.
Almost 30% of the alcohol advertising, particularly on TV and in the newspapers and on billboards, had violations in terms of the content that was broadcast. It should not be broadcast because it could influence young people.
For countries like Malawi, alcohol consumers are said to be high binge drinkers. It is feared that if the young population is drawn into drinking, the situation will get even worse.
It's the communities, it's the parents, public health experts, and health officials who should determine what young people are exposed to when it comes to health-related behavior, not some commercial interest.
This is not going to be helped by the unregulated liquor markets.
Regulate alcohol consumption, alcohol production, and actually alcohol sale.
The huge amount of alcohol that's not under any kind of state surveillance in places like East Africa, I think it's worth looking a bit at the history. It took a century for France to get control of its alcohol market. I would like to learn more about what's happened in Kenya with their experiment with trying to bring the informal distillers into the legal market, you know.
We lost about 80 people in 2010 who took the adulterated alcohol.
The alcohol policy would check on Uganda's alcohol consumption. As Alcohol Epidemiology Symposium sets its eyes on Kampala for this annual conference, public health experts want countries to consider a ban on advertising. Florence Salimba, NTV.